guess what? This is Pickleball Terry, and I'm here with Frank from our place. No, the Pickleball
Your
PT.
place. Yes,
your
the Pickleball PT. Yeah, you got it.
And Frank, your last name is Dr. Frank Allen. I'm so
Allen,
close
yes,
to you.
ma'am.
I must be like freaking you out.
No,
now.
not at all.
Okay. All right, so Frank and I met each other, I'd say 2 years ago.
About 2 years ago
When
when I
you
first
first
moved
moved?
down to Sarasota. Yes, ma'am. Yeah,
From-
that was October of 2020, so a year and a half ago. Yeah.
And I'm probably older than Frank's parents. And we play pickleball together.
We do.
And-
It's part of why it's such a great game.
I know, that's part of why it's such a good game. Yeah, I can talk. So anyhow, Frank, since I've last seen you, which has been like a year ago,
It's been a while, yeah.
and you kind of like, you got busy with your business. We're now in your office.
Yes, ma'am.
He's a physical therapist, if I didn't say that before. He specializes in pickleball.
Pickleball, yes.
That's right. And
It's a great thing to specialize in.
did you grow a beard since the last time I saw
I have
you?
a little bit growing, yeah.
I like
Yeah,
it. It
yeah.
looks great.
Thank you.
In a motherly sort of way, I'm saying that. So anyhow, you and your wife had a baby.
We do, yes. She's 9 months old. This is her.
This is her, right
That's-
here.
that's
And it's
her.
not fair because she looks like you.
She does. She looks
That's
mostly like me.
she
Yes.
does. She
Poor
looks
girl.
so I know.
Poor girl. Yeah.
So what about now? Her name is
Adelaide.
Adelaide.
Yes.
Adelaide,
Adelaide, yes.
And do
Addie
you-
for short.
and you call her for Addie.
Yes, ma'am.
Okay. So anyhow, we're here together today because people ask me all the time. Here I got my sorry shirt on. Why a lot of things, injuries in pickleball, and I am totally not capable of handling them or answering their questions. And so I have come to you for knowledge.
Happy to help.
Thank you so
Yes.
much. So the number one thing people ask me about is tennis elbow.
Tennis elbow. Okay. We'll call it pickleball elbow for the purpose of this
Pickleball
video.
elbow.
Yes.
Okay, that's good.
So what pickleball elbow is it's a tendonitis or an inflammation of the tendon that inserts at the elbow there, and it actually is mostly related to problems with the wrist. The more limited your wrist range of motion is, especially into extension of the wrist, then that causes the muscles that attach up here that perform that action to have to work extra hard to do that movement. And that limitation in movement at the wrist, as well as tightness in the front of the forearms, which you get a lot from gripping paddles and playing often, is enough to trigger an inflammatory response where those tendons insert up at the elbow here, and then you start feeling pain in there, and then you get weak with your grip, and it completely throws off your game, not only your game, but day-to-day life as well. Things like driving, holding glasses, and all that sort of stuff becomes very painful and difficult. So it is essentially an inflammatory condition that involves those tendons that insert up there, and the way to prevent it is to maintain mobility in your wrists, both into flexion and extension. So just doing simple stretches where you're pushing back like this for a couple minutes each day and pushing down the other direction to keep the mobility high, as well as working on strengthening the muscles in your wrists and forearms to make sure that they can tolerate the amount of activity that most people, when they play pickleball, they're playing multiple days a week, multiple hours a time, that sort of thing. So it's a lot of stress and strain.
So you're saying, excuse me, that maybe they shouldn't play as much?
I never tell my clients to don't play as much, because
Okay.
that is nothing they want to hear. There are things you can do, though, to mitigate the effects of playing that much, and that would be, if you are going to play that much, you have to make sure that you take care of yourself, that you stretch regularly, that you listen to your body, that you do other things to maintain the strength and function of the areas that you're using. And so you can't have your cake and eat it too. If you're playing constantly, eventually things are going to start to break down if you don't take the measures to make sure that they don't do that. Yeah.
Okay.
Yep.
Okay, so I tell them, like, I look at their grip.
Mhm.
And if they're like, their grip is too big and they're straining
Yes.
to hang on to that grip,
Mhm.
I tell them that could be one of the causes.
100%, absolutely, yep. And a lot of people grip the paddles way too hard in the first place. There are modifications of your grip that you can implement as well and play one game with one certain grip and then another game with a different grip. I know that might throw some people off, But another thing that you can do is between points and sets and games, either don't hold the paddle at all or put it in your non-dominant hand. Things that you can do throughout the course of play to limit how much and how hard you're squeezing that paddle. But finding a paddle with the right grip for you and that size grip is very, very important, and that's something that a lot of people don't take the time to do either.
Yeah, I'm a grip person. I can tell just by looking at somebody if they have the correct grip, if they're strangling the grip too much. I tell them to loosen up a little bit. And another thing that I tell people all the time is go for a heavier paddle.
Yeah,
because the heavier the paddle, the more work the paddle's going to
be
do.
doing. Yep, that's very true.
So when I use this example, I say, here you got a piece of wood and you've got nails, big nails in it. Now, are you going to use a little tiny hammer to hammer all those nails, or are you going to use a big hammer?
That's a very good analogy, and that makes sense. Yeah.
Yeah, so I tell everybody, I personally like an 8 or above ounces in my paddle, and I know pros use lead tape, and they're 10 to 12 ounces, and for some reason, people are always looking for a light paddle because they think that's the answer.
Yeah, and the companies do a good job of marketing that light as a better thing, but no, you're right. You have to squeeze and put a lot more force into that paddle every time you hit the ball to get the same force and distance and accuracy and all those sort of things with a lighter paddle. So there are pros to lighter paddles, but there are also definitely cons. So that is something to absolutely take into account when you're purchasing your next paddle.
Well, yeah, and I happen to sell Gearbox. Come and see
There you go. Absolutely.
So anyhow, thank you. Thank
Yes,
you so
ma'am.
much for that. Okay, so let's move on.
Let's move on.
Okay, the next big thing are knees.
Knees, okay.
Oh my God. Everybody. And do those bands really work? You know, the bands that they wear. Not the whole cover, but they use those like bands just around the outside.
To that can help kind of mitigate the symptoms of tendonitis if you already have it, by keeping that tendon from getting too inflamed. But they control the symptoms possibly, but they don't work for everybody. Your best bet is, again, prevention is going to be the name of this whole talk, but your best bet is doing things to make sure that your knees are as unloaded and mobile as possible. So with knee pain, more often than not, when you're talking pickleball, that pain is coming from either arthritis in the joints, which is just inflammation and roughness, and that smoothness starts to get lost between the bones of the knees, or a tendonitis either in the patellar tendon, or you have people that have IT band syndrome as well, which is that tight band that goes down the side of the leg and attaches at the knee. Those three things are probably the most common causes of knee pain related to pickleball. All three of them can be significantly reduced by maintaining a couple different things. So first one, and probably the most important one, is the strength and function of your glutes. So those butt muscles, the hip extensors and hip abductor muscles on the outside and back of your hip, they play a large role in unloading the smaller joints lower down the legs, so the knees, the ankles, the joints in the feet, that sort of thing. So the stronger and better functioning those glutes are, the less pressure and stress you're going to have going through your knees, and the more those glutes will be able to absorb a lot of that force.
Wow.
So when they get weak, then not only is excessive stress and strain going through the joints of the knee as well as the tissues of the knee, but your mechanics get thrown off as well. You start to increase your compensations and things. That it's very subtle. You don't really realize it's happening. But over time, if you aren't moving the right way and using the right muscles at the right times, then your body starts to literally change and stray from that normal way of moving, and that puts a lot more stress and strain on areas of your body as well, the knees included. So maintaining strength in the glutes and function of those glute muscles is probably the biggest thing you can do to prevent knee pain associated with pickleball. Another thing is making sure to stretch regularly the muscles that attach around the knee, so the quadriceps, the hamstrings, the calf muscles, keeping all those loose to where when they attach at the knee, if they're tight, they're going to be pulling and pulling and pulling and pulling, and that limits motion and increases inflammation. Both things create pain. So maintaining mobility of those tissues as well as the joints in the knee itself to make sure things are moving smoothly and not getting irritated as much as possible when you're playing. That's the other big thing that you can just work on as much as you possibly can. Between games. It's not something that you're going to be able to do mid-game or anything, but between games or days that you're not playing, take time to stretch, take time to strengthen those glutes, and then enjoy the relief that you will feel in your knees.
Wow. What about the meniscus?
That's a load-bearing structure, so it's kind of just like a shock absorber, essentially, in the knee joints. And that's another thing, that when your glutes are weak or your mobility is thrown off or your movement mechanics aren't sound and you're compensating, then you're going to put more stress either on the inside or the outside of the knee when you're moving and not even really realizing it. All those ground and pound movements of pickleball, jumping, running, lunging, that sort of stuff. The meniscus takes the brunt of that, and it's just another structure in the knee that can get excessively beat up if your body isn't capable of unloading it the way that it needs to be unloaded, which again comes from those glutes and those muscles in the hips and the thigh and the core.
Wow. Okay. That's great information. All right, so the next thing, plantar fasciitis.
Plantar fasciitis, yes. This is actually, that and calf strains are probably the most common things that I myself have treated pickleball players for. I would probably say 1 in 4 people that I work with are dealing with some sort of calf or plantar fasciitis issue, and they're related to the same problems. So they are related to tightness in your calves or limitation in ankle mobility, and then combine that with repetitive stress and strain, like walking, playing pickleball, being on your feet for a long period of time, that sort of thing. That's enough to trigger an inflammatory response in the plantar fascia, which is a thick, dense connective tissue band that runs down the bottom of your foot. It starts at your heel and makes its way towards the toes. When it gets inflamed, it serves a job of kind of being a support structure for the arch of the foot and the bottom of the foot and all those tiny joints there. But when it gets inflamed, your heel, it attaches at the heel of the foot. And a lot of people feel like that first step they take in the morning, or if they've been sitting for a while and they go to stand up, it's like a nail is just getting driven up into their heel. Very, very, very painful, extremely painful. And you can imagine how limiting that would be when it comes to pickleball. So maintaining mobility of your ankles so that you can walk normally and run normally and continually stretch those tissues out that attach on the bottom of the foot and the back of the leg. That helps keep things as even-keeled as possible and limits the chances of an inflammatory response from onsetting in the plantar fascia itself. So another thing to keep in mind is that glute strength. I don't have anybody that I treat for plantar fasciitis that I don't give exercises to stimulate and build strength and function in their glutes for the same reason that I mentioned before. When you're stronger in your glutes, all those tissues and joints further down the leg and into the feet are unloaded and less stressed, so the plantar fascia is included in that. Strong glutes, less stress and strain on the plantar fascia as well. So big things with plantar fascia, ankle mobility and glute strength. That's things that you want to focus on. So regularly stretching your calves and regularly strengthening your glutes are going to be your best bet at keeping that plantar fasciitis at bay. Another thing is, I'm sure you've heard of foam rolling. That is very beneficial for keeping the tissue mobile in your calves, as well as you can roll along the bottom of your foot as well to keep things from getting so tight. That's a good thing to do like after you play and before you play, to keep those tissues from getting to the point where they just get tighter and tighter and tighter and tighter with every day you play. So foam rolling is a great tool as well for pickleball players.
Wow. Now a couple people recently have told me they blew something out in their calf.
Yes, yep. So that's
that's
a calf strain. Probably the most common pickleball injury that people suffer on the courts. That quick transition from going back towards the baseline to immediately sprinting back up to the kitchen line is when it typically happens, and somebody's going from their heel and pushing off to run forward, and that calf muscle just tightens up so much that eventually it pops and something tears. Sometimes it can occur at the Achilles tendon, sometimes it can occur in the muscle belly of the calf. They come in different degrees as well. There's a grade 1, which is a low-level strain. There's a grade 2, which is mid-range, and there's a grade 3, which is typically a complete tear of the muscle tissue. So obviously the complete tear is the one that you want to make sure you avoid, but all the other ones are very painful and limiting as well. And if you do have any tightness in your calves, like if you're out there playing and it's 10-8 and you feel something tighten up in your calf and you're like, let's just finish this one point, that can be something where it's the straw that breaks the camel's back, and you step wrong or do something and then boom, pop. So you want to make sure with the calf strains that you definitely listen to your body. If you start feeling something tighten up, having something like that occur is not worth finishing the game. And even if you have to tell the people that you're playing with, like, hey, something's wrong in my leg, like I can't finish this game out, that's much smarter than playing through it and having something go drastically wrong that sets you out 6, 8, 10, 12 months sometimes for people. So
wow.
Calf strains typically don't occur without a pre-warning, and everybody that I've worked with that has suffered a calf strain, they said, yeah, I could kind of feel it getting tighter as the day was going by, and then I just continued to play, and then that was the wrong idea.
Wow.
So your body will let you know if something like that is coming. It can occur where you just take off real quickly and something pops, but that's a lot less frequent. But the ways to prevent that, again, stretching your calves regularly, maintaining strength and normal function of the glutes is a common theme here with lower extremity stuff. Regular stretching and strengthening those glutes. That's huge keys for prevention of any sort of lower extremity issue, whether it's associated with pickleball or anything else.
All right.
Yeah.
Does this happen generally to older people, to the seniors?
So the age isn't kind to anybody's body. So the natural process of aging increases your risk for having any sort of these musculoskeletal issues, the tendonitis, the arthritis, the meniscus issues, that sort of thing. Those are all much more likely with the aging population, especially the active aging population. But it can occur in people in their teens, 20s, 30s as well. No one is immune from it. It's just younger bodies are more capable of performing the activities like pickleball without the major issues. But that just makes it more important if you're 45 or 50 and above and you're regularly playing pickleball to make sure that you are doing things outside of the pickleball courts, like the stretching, like the foam rolling, like the exercises and strengthening to make sure your body is capable of continuing to play without any of those adverse reactions. So it takes work to be able to enjoy the things you love.
Wow. Okay, this is kind of scaring me.
So well, you're doing just fine.
So yeah, I know. I have been so far, knock on wood.
Yep.
Lucky. All right, we're going up to the rotator cuff.
Okay. Yep. So the shoulder, we use it all the time, especially when we're playing pickleball. The big thing with shoulder issues is posture. So our bodies are designed to be nice and upright, and most people's bodies, especially as we age, that spine starts to curve down like that. With that curving down of the spine, your shoulders round forward as well. When those shoulders round forward, you have tendons and things that run through there, the rotator cuff tendons, the biceps tendon that comes up, that there's a small amount of space that they have to run through. And when that shoulder rounds forward, that space gets even more closed and less. So not only that, but whenever you raise your arm up or go back like this, which happens a lot with pickleball, that space, when it's closed, creates an environment where those tendons get irritated and rubbed up against by bones and other things within the shoulder complex. So when those bones are rubbing up against those tendons don't like it, they get inflamed, they get irritated, and then you end up with a tendonitis, which is a very painful condition of the shoulder. It also, similar to the tennis elbow or pickleball elbow, causes weakness, limited mobility, all sorts of things that affect your pickleball game as well as your ability to live life in general. So the best way, number one way I tell people to make sure that they don't develop any tendonitis in the rotator cuff is be very mindful of your posture when you're sitting and standing, shoulder blades back, chest out, chin tucked, everything nice and upright. It's work, again, to maintain those sort of postures, but your body appreciates it and it functions a lot better if you do. Neck pain, shoulder pain, back pain, even low back pain can be significantly improved by just making sure to maintain proper posture. So that is the big thing. The other thing to prevent rotator cuff tendonitis is making sure you regularly stretch the tissues that attach to the front, which are mainly the pectoral muscles. So doing things to improve the flexibility of your pecs helps make it easier to maintain proper posture, because when these are stretched out, they're not pulling your shoulder forward, and it just helps out with keeping things as uninflamed and happy in the shoulder as possible. The third thing, so posture, shoulder flexibility in the front. Third thing is strengthening of the muscles in the back. So a very common exercise is just like a row against resistance, or literally just taking your shoulder blades and squeezing them down and together. There is another thing that you can do to help stimulate the function of those muscles and make sure that things are functioning as optimally as possible in the back there. So the stronger you are in the back, the more likely your shoulders are to be kept back, and the more flexible you are in the front, the easier it is to keep those shoulders back as well. And then just having that little voice in your head that says, make sure you sit up straight and stand up straight. Those three things are going to be your best bet at preventing shoulder tendonitis or rotator cuff tendonitis.
I did not see that one coming. That one surprised me.
And whether you're a banger or a soft game player or whatever it might be, you're at risk for developing all these sort of things just because of how frequently your body has to move playing pickleball, upper extremity and lower extremity. So if pickleball is something you're serious about, which if you're watching this video, chances are you're serious about pickleball, you're just a kind of common theme in this whole video is you have to put in the work to make sure you can enjoy it without the issues that are very, very common with pickleball. So being mindful of your posture, strengthening those glutes, strengthen those muscles between the shoulder blades, listening to your body. If you feel something that's not right, don't push it. All things that kind of seem like relatively common sense, but you would be surprised at how many people just completely ignore that sort of stuff. Yeah.
So I have, as a coach, I have this problem where people are told pickleball is really easy, you know.
It's a big problem.
And they come to me for a lesson and they have no mobility as far, they have, you know, no balance.
Yep.
I am scared the entire time that they're going to fall.
I could imagine, yeah.
So I've caught a few people.
I'm sure. Oh, yeah.
Just had somebody fall the other day, hit her face. It was horrible.
Yeah.
And obviously they don't have any kind of athletic ability.
Yeah,
but somebody told them pickleball was a piece of cake, and that's why they're there, and it makes me nervous.
And they learn that lesson the hard way, it sounds like. But it's a game that requires a lot of agility and a lot of mobility and balance and coordination and things like that. And it's part of another reason why it's such a great game is it is relatively easy to learn. But if you can't move or you can't just do the basics of just running and things, then it'll be very difficult and dangerous. Yeah.
Yeah, one of the things I do is I make them sometimes. I do a few of those exercises that you showed us, you know, warming up.
Yep.
And one of the things is 10 jumping jacks. And there are women will not do those.
Wow.
And if they're not ready to do those 10 jumping jacks, what are they doing coming to pickleball?
You know, it's I don't really know. They had the wrong idea, it sounds like.
Sounds like
But speaking of jumping jacks, that's actually a great way to warm up before you play pickleball, like you just said. Full body movement. Another way to prevent injuries, all these injuries that we just talked about, is making sure you warm up properly. So taking 4 to 5 minutes and actively warming up, getting your heart rate going, getting blood pumping through your body, getting those joints loosened up. It's a lot more effective and decreases your risk for injury to warm up that way than it is to spend 10 minutes just stretching your hamstrings and quads and calves and things like that. A warm-up where you're constantly moving, even if it's very low-level movement, is much better at improving your performance and reducing your risk for injury than if you got to the court and, like I said, just spent 10 minutes just stretching your muscles out. Because you want to actually warm up. You want to warm up. When you're stretching, you're not really moving. You're actually cooling down. So keep that in mind as well before you go play, even if it's just practicing. Just take 3 to 5 minutes and spend some time just moving and getting your body warmed up and ready to play. And you'll be surprised at what it could do for you.
Well, this has been great.
Yes, ma'am.
Are there anything prominent that I have forgotten as far as injuries?
Those are the big ones with pickleball. It's a sport that involves your whole body, so you're going to get aches and pains from the fingers and joints in your knuckles all the way up through your neck and shoulders and hips and knees and back and all that sort of stuff. But as far as the ones that I've most treated pickleball players for, it's the plantar fasciitis, it's the calf strains, it's the knee pain, it is the shoulder tendonitis, and the pickleball elbow. So you covered all the bases. This is a very, very informative and comprehensive video here, Terry.
So anyhow, I will have all your information
Yes, ma'am.
in this video at the end. so they can contact you
Mm-hmm.
because you are the man to come to.
I appreciate that.
Absolutely. For pickleball injuries and to prevent them.
Yes,
definitely.
that's the big thing. Yeah.
See Dr. Frank.
Come and see me.
Or Dr. Allen.
Yes,
Do you like Dr. Frank?
either one.
Dr.
Yeah,
Allen?
either one's fine.
Okay.
But I offer completely free injury risk assessments, no commitment necessary. I want to help pickleball players, and even if you're not a pickleball player, if you just want to know how your body is doing, strength, range of motion, balance, mechanics, all that sort of stuff. I got into this to prevent injuries and help people enjoy what they love, and part of what I do in order to do that is offer those free assessments. So if you're just
Wow.
interested at all at how your body's performing and ways to prevent injury, come in and see me and come in for an assessment.
Oh, that's fantastic. Thank you so much for doing
My
this.
pleasure. Thank you for doing it. I hope a lot of
right.
people get some helpful information from this, and if we can keep some people out on the courts and free of injury, then it was well worth it.
Absolutely. And do you think we'll ever play again together?
I hope so. Now that my daughter is, a little bit older, and I don't have to spend. I shouldn't say have to spend, but I was able to get out last weekend. That was my second time playing all year, so I'm back at it. So I'm going to try to get out again this week. My goal is once a week at least. So
Oh,
yeah.
okay.
Yeah. And where are you playing?
Well, how about like Saturday we meet at Core SRQ?
Okay, that's right
Okay.
around the corner from my house.
All right.
Yeah.
So then, oh no, not that one.
Oh, you're at the Y?
At the other one on
Potter Park?
Not Potter Park, but the one off Bay Vista.
Oh, okay, Vista. Okay.
Remember
all right.
the-
Yep.
we used
I
to
remember.
come.
Yes, ma'am.
Okay,
Yep. Okay,
so-
I'll keep that in mind.
All right. Well, maybe let's try.
Let's try.
All right.
Yes.
Thanks. Bye.
Bye-bye.